All right, here we go with chapter 14, hearing loss in adults. The main question for this chapter: what is adult hearing loss? How is adult hearing loss classified? What are the defining characteristics of prevalent types of adult hearing losses? How is adult hearing loss identified? And how is adult hearing loss treated in evidence-based practice? So hearing loss is an invisible disability, right? It's not something you can see when a person walks up to you, but can have a profound effect on someone's life. Hearing loss in adults often emerges gradually with age. So, for the average adult who gets hearing loss, it just comes on as people get older, and we'll talk about that. It can be mistaken for cognitive decline or psychological issues, right? So people can think, oh, this person is losing their intelligence when they're actually just not able to hear everything in their environment. And it can also be mistaken for depression as people start to withdraw from life. Untreated hearing loss can have detrimental effects on social, emotional, psychological, and physical well-being of participants. And people may resist seeking intervention for hearing loss. There's a perception that the hearing loss is not severe enough, so people will say, oh, it's not that bad, I can usually hear, it's fine. Concerns about the costs associated with treatment. Even with insurance, it can be very expensive for some people. Negative images associated with hearing aids, right? Not that long ago, hearing aids were large and bulky, and really any kind of difference in anybody was perceived as being much more negative than it is today. We've come a very long way. We still have a long way to go, but we've come a really long way in accepting differences in people. Thank goodness. What is hearing loss? It's a deviation or change for the worse in either auditory structure or auditory function that differs significantly from normal. That wording is not great, but that's what's in your book. I'd say it's really, the words worse and normal aren't super, but we can talk about that. If loss impacts a person negatively, it's considered a hearing handicap or a hearing impairment. 3 classifications of adult hearing loss. Just like we talked about in chapter 13, there's sensory neural hearing loss, damage to the inner ear and or the cochlea or the auditory nerve, whereas conductive loss is going to be due to damage in the outer or middle ear. This is going to be much more rare in adults than it is in kids, because adults aren't as likely to get the middle ear infections that little kids are. And then we've got the mixed loss, which is a hearing loss that's both sensory neural and conductive. Just a few terms to think about here. Recruitment is a reduced tolerance for loud sounds. So, somebody might have been able to tolerate car alarms, fire alarms, things like that. And then recruitment means they're going to have a reduced ability to tolerate that. They might cover their ears. They might have real difficulty with that. Also tinnitus, which is a ringing, roaring, buzzing, or hissing sound in one or both ears. It's caused by damage to the inner ear or can be related to things like high blood pressure, stress, fatigue, excessive caffeine. And tinnitus can be really annoying for people because you have this ringing, buzzing, hissing sound in your ear in one or both ears all the time. And it becomes hard to hear what other people are saying. Plus, when you're going to sleep or something, you hear this sound in your ear. That's very uncomfortable. And there's really no known cure or treatment for tinnitus. Also, signal to noise ratio loss. This is hearing loss due to inner hair cell damage, and often people would say they could hear if speakers didn't mumble or there wasn't background noise, right? So we've got the signal, a person talking, and then the noise is all the background noise. So you can almost hear the noise, the background noise more, and you can't hear the person talking. So maybe people can hear okay. If it's totally quiet, they can hear you talk. But then if there's any background noise, they're going to have a really difficult time picking out your voice versus that background noise. Hearing loss goes undetected or untreated in more than 75% of adults with hearing loss, right? It's a tremendous amount. Left untreated, it can really impact hearing acuity and clarity. So it's going to impact what you can hear, but also how clearly you can hear it. So a few more terms here. Hearing loss is an objective measure. It refers specifically to a decrease in hearing acuity or clarity as a malfunction of the hearing mechanisms, whereas the handicap, disability, and or impairment references the impact of hearing loss on daily living activities, right? So the hearing loss is specifically on the audiogram, what you can and can't hear, whereas the handicap disability is, what are you able to do or not do, and how easily can you do it? And then presbycusis, we talked about in the opening, is hearing loss that occurs as a result of aging. So, as people get older, they may, just as a result of aging, start to lose their hearing. That is presbycusis. And it's acquired, more often from exposure to noise. So in adults who have been in noisy jobs or have listened to loud music over prolonged periods of time, they're going to be more likely to develop presbycusis. Hearing loss in the adult population is classified in terms of the etiology or cause and the severity. So etiology identifies the area of the auditory pathway or brain that's affected. So what's the cause? Conductive loss is in the outer or middle ear, as we know, and sensory neural loss is in either the inner ear, the cochlea, or the auditory nerve. Severity of hearing loss ranges from mild to profound and typically defined using decibels. So your book says 10 to 15 dB is normal hearing. Sometimes people will go all the way up to 25 as normal hearing, but we're going to identify 16 to 25 dB as a slight loss, 26 to 40 as a mild loss, and going all the way up to, if we're at greater than 91 decibels, when we can finally start to hear, that's going to be a profound hearing loss. The defining characteristics of prevalent types of adult hearing loss. So we're going to talk about these: conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. Conductive hearing loss is much less common among adults than among children, right? Kids are going to be more likely to have ear infections and things like that. It occurs when sound is not conducted efficiently through the outer and or middle ear. It results in an attenuation of the sound, right? So something's blocking that sound from coming in your ears. It creates a sense of fullness or plugged ears, right? So especially if you have a middle ear infection, you're going to feel like your middle ear really is filled up with goo. So that makes sense. It causes a slight to moderate loss of hearing in one or both ears, and it's amenable to medical or surgical intervention. Sometimes it can be as simple as taking the wax out of someone's ear. Sometimes it could be an antibiotic. So usually, often, it's a pretty simple cure. So causes can be cerumen, blockage, wax, foreign objects put in their ears. Again, it's going to be much more common also with kids. Otitis media, the middle ear infection, more common with kids. Any kind of damage to outer or middle ear. So if someone's been in a car accident or had someone poke their eardrum, that's going to be an issue. And then also otosclerosis is abnormal bone growth around the ossicles in the middle ear, impeding their movement. So the bones in the middle ear aren't able to vibrate as well and aren't able to bring that vibration into the inner ear so you can hear as well as you used to be able to. Sensory neural hearing loss is the most common type of hearing loss in adults. It results most often from damage to the outer or inner hair cells of the cochlea. Outer hair cell damage often results in difficulty with hearing acuity. Inner hair cell damage results in a sensorineural hearing loss. Results in both a decrease in acuity and a loss of clarity, especially in noise. So, as that noise increases, it's going to make it really hard to hear if there's background noise. The person may experience recruitment. Remember, where you're really sensitive to loud noise, and or tinnitus, the ringing in your ears. It's treated with amplification or other types of intervention. Causes and risks. Oh, here we go. Causes can be presbycusis, which is a degeneration of the inner ear and other auditory structures as a result of the normal aging process, and also noise exposure, and factors which influence and the impact of noise exposure, the intensity of the noise, the length of the exposure to the noise, the use of hearing protection, right? So if you have little kids wearing some noise canceling headphones to really noisy events, even as adults, if you're going to a lot of concerts, some kind of hearing protection can be really helpful. Some people have really noisy jobs, construction workers, things might be really loud. So some kind of hearing protection is really important. The recovery time between exposures, right? Is this your job? Are you there every day? Are you going to one concert a year? And even though it's way too loud, your ear is time to recover, and other forms of damage to the cochlea. More causes and risk factors, ototoxicity. So certain drugs can really damage the ears. There are some drugs that are used that are life-saving drugs, but are known to cause hearing loss. But if that it becomes a last resort to save someone's life, they're going to give it to the person, and they're just going to lose some or all of their hearing, but they're going to keep them alive. Meniere's disease, which is a long-term disorder caused by overproduction or underabsorption of endolymph, a fluid that circulates in the inner ear. Labyrinthitis is also an infection, but this is a short-term infection that's treated medically. Meningitis, another infection that can result in sensorineural hearing loss. Also, acoustic neuromas, which are going to be tumors on the auditory nerve. And for, certainly the tumors, but for other factors as well, a common symptom of this could be vertigo. So if somebody feels really dizzy, that can be a sign that there's something wrong with their inner ear, even though that might not be the first thing you think of. Finally, we've got a mixed hearing loss, right, which is a combination of a permanent reduction of sound and a temporary loss of hearing from a conductive component. So it could be the results of otitis media or a buildup of wax, cerumen, along with a sensorineural hearing loss. How is hearing loss identified? So we're going to talk about the assessment process briefly here. Sometimes there'll be an audiometric screening, but more likely we'll go right into a complete hearing evaluation, including OAEs, otoacoustic emissions, and EAPs, evoked auditory potentials, where you're going to see what the person's brain is able to hear and not hear. There'll also be self-assessment instruments. So these will be surveys for the person, their spouse, their family, to see what their hearing's like, how often they're asking for correction, how loud the TV has to be on, things like that. And the goal of the assessment process is to determine the degree of loss, the type of loss, the likely cause of the hearing impairment, and the person's speech perception ability, both in quiet and in noisy environments. An audiologist will also do an assessment for hearing aids, right? So how well do hearing aids going to help? What's going to be the best kind of hearing aid? And then also an oral rehabilitation assessment. So, right, how much is this impacting the person's life, and how much would a hearing aid positively impact a person's life? So this is really important, right? Negative consequences of mismanaged hearing loss. Either people aren't going to the audiologist or are getting an incorrect diagnosis here. It can really impact their general well-being, their lifestyle, their interpersonal relationships, their economic livelihood, right? If you can't hear, especially being able to hear speech, it's going to have a real big impact on what you're able to do, just economically, socially. It can really have a negative impact if it's not treated correctly. So a little bit on treatment of adult hearing loss. Human auditory system remains plastic throughout life, so it can change. So, people get, even though people get older and, often they're going to lose some hearing, we can bring that hearing back either through all kinds of things, which we'll talk about in a second. The most effective treatment approach for adult hearing loss is an individualized and comprehensive plan. Counseling is going to be really important. A lot of people, will get a hearing aid, but if they don't know how to use it or they don't know why it's important to use it, it might end up getting put in a drawer, and then it's not help to them at all unless they have a good understanding of how to use it and why they're using it. Getting a fitting of amplification devices is really important, and then also oral rehabilitation. So are they using it? Are they using it when they're watching TV? Are they using it when they're talking to people on the phone? Are they using it when they're talking to people in real life, right? How is it, when we talk about oral rehabilitation, we're talking about, in real life, is this really making a difference? And how can we help the person live the best quality of life they possibly can? So, limitations of current approaches. First, the good things: most hearing aid recipients received information focused on audiogram results, reasons for the specific hearing and selection, care of the hearing aid, care of the hearing aid battery, hygiene for the hearing aid, and ear mold, right? So all of that is really good. However, really important things was neglected, right? Involving spouses and family, was neglected in almost 80%. We've got consumer resources and self-help groups. Oh, that should be 19.5%, not 195. So, again, more than 80% of people were not talked about. Consumer resources and self-help groups, strategies to improve communication, and then more than 85% of people were not counseled with the idea of strategies to deal with hearing loss at work, right? So, audiologists are doing a great job, but they can do a little bit better in the counseling area. Just a little bit on assistive technology. So the idea of hearing aids here, almost all hearing aids now are digital. They can hook right up to your cell phone. You can control the loudness. You can control all kinds of things. You can see the battery life. They're pretty amazing. Someone with a very severe loss might need a behind-the-ear hearing aid. Most hearing aids now are very tiny and are in the ear. And they've got directional microphones. So they can be, usually the microphones are going to be set so that where the person's looking, where their head is turned, is going to be where it picks up the sound the best. But depending on the person's job or other things, maybe they want to hear more holistically around them, and that can be done as well. Cochlear implants are also possible in different kinds of surgically implanted devices. So not only cochlear implants, but also middle ear or mastoid implants and brainstem implants are possible with adults, depending on the type of hearing loss they have. So there's so many more options now for people than there used to be. Optimal candidates for a cochlear implant are going to be people who are postlingually deaf with moderately severe to profound bilateral sensorineural hearing loss are the best candidates. People with marginal or no speech perception, even with hearing aids. Good health with no physical abnormalities of head and neck. And also access to optimal education and rehabilitation services following implantation, right? So are they going to be able to come to follow up appointments to be able to learn how best to hear with their cochlear implant? All right, oral rehabilitation. So the most important thing is that people can live well with their hearing loss, right? So audiologists and those working with them will examine communication breakdowns. And the goal of oral rehab is to evaluate communication partners' roles in conversation, to determine whether social rules are being broken, right? So are people able to hear? Are people talking over each other? And teaching strategies to facilitate communication and repair breakdowns effectively. And that is the end of chapter 14.